Hi, I'm John Bloom, a physician and the CEO of Podometrics, and I'm thrilled to be here today to talk about the number 0 and what it would mean for our veterans. Diabetes is the number one cause of amputation in the world, the US, and among our veterans. And partnering together, we have the chance to aim for the complete elimination of limb loss due to diabetes. 0 amputations resulting in loss of a leg, loss of a veteran's independence, or loss of life. It's a problem that contributes to $3.2 billion in direct expenditures each year in the Veterans Health Administration, a killer worse than most cancers, and is considered one of the greatest markers of health inequity we have in the United States. I want to share with you two stories today, the stories of Robert and Walter. Their stories are all too common and in fact represent the 501,000 veterans with high-risk diabetes actively receiving care by the VHA every year. Let me first share the story of Robert. Robert is a Vietnam veteran who's had diabetes for many years. He's struggled to keep on top of it, and as a result, he's lost sensation in his feet and has had some other challenges related to the disease, including multiple wounds called diabetic foot ulcers to his right foot. One day at home, Robert noticed some discoloration under a callus on his right foot, but it wasn't enough to impact his daily life, so he didn't take any action on it. Shortly after, he was unaware, but that callus broke open, revealing a small wound. That small wound turned into a bigger wound, which got infected. And it wasn't until his son noticed a change in the smell around him when he was visiting one day that something could be wrong. In fact, something was very wrong. At the urging of his son, he sought attention at the local VA Medical Center's ER. The doctor takes one look at the foot and notices the inevitable. He's going to lose his foot. Probably his right leg at that knee. And when it's done, his 5-year mortality will be as high as 70%. After a long hospitalization and rehab stay, he was bound to a wheelchair, unable to go about the life that he used to know. It's all too common, and it shouldn't happen anymore. Now I want you all to meet Walter, another Vietnam veteran. Walter has also dealt with diabetes and its complications since he left the military in his 30s. Like Robert, Walter eventually lost feeling in his feet and has had extensive wound history to his left foot over the past several years. However, Walter is now enrolled in a program for amputation prevention using the Podometrics SmartMat. This program allows us to keep an eye on his feet daily, allowing clinicians to detect 97% of foot ulcers on average 5 weeks before they present clinically. This time things were very different. One day the system noticed a new occurrence of inflammation at the same spot he's had multiple wounds, which is this, we'll call it the left fifth med head, that spot on the left foot. The veteran was called in to see the podiatrist shortly after. The clinician noticed the same thing that Robert had seen previously. It was a callus with a darkening under it, which represents some hemorrhage below that level, the surface of the skin. This is a pre-ulcerative lesion, so a wound that hasn't happened yet. After a quick cleanup of the callus, the clinician also made a small cutout of the insole, the surface below that foot, to sort of relieve some of the pressure at that location. He sent him home, the episode resolved, and he's been ulcer-free ever since. That's it. That's the story. Here's 2 patients that are almost identical, except for one patient who's left completely on his own and didn't know to seek care until it's too late, and one who's enrolled in a VHA program using the latest in data science to monitor for issues before they become problems. That's the difference, and it's a huge difference, a huge leap forward in patient care as it's done today. Like Walter and Robert, 1 in 4 veterans have diabetes. Yet too often we're ignoring one of the most common, debilitating, and expensive complications of diabetes, the diabetic foot ulcer. The VA spends, as I mentioned, $3.2 billion each year treating diabetic foot complications, despite the fact that they are largely preventable. Before starting Podometrics, I worked as an anesthesiologist, and I saw the impact of these complications firsthand. It baffled me that we would spend whole days at times in the operating room doing nothing but amputations. Essentially Civil War medicine for something that should not happen anymore. We knew this had to be a problem to be solved. This problem had to go away, and it could have a huge impact, especially for our veteran population. As I mentioned, diabetic foot complications are very expensive and cost as much as 1/3 the total cost of treating diabetes as a whole, yet are largely preventable. 1/3 of the cost. But the real challenge isn't the science of detection. The real problem that had to be solved was one of long-term engagement. How do you make it so easy that patients, often overwhelmed with their care, choose to use it every single day? What we came up with was the SmartMat, which when coupled with wraparound care support, which we provide, makes it easy for the patient to engage. And here's how it works. Patients just step on the mat for 20 seconds a day and then go on with the rest of their life. But in that moment, we get a temperature scan of the feet, which is sent wirelessly to our care team, who can then use these data to work with VA providers to offer simple and inexpensive preventative care if needed. The device is cellularly connected, meaning it requires no Wi-Fi, no smartphone to use it. It's good to go out of the box. And we find this is critical as many of our veterans lack access to some of the technology that many of us might take for granted. Long-term engagement turns out to be one of the single biggest drivers affecting outcomes, probably not surprising. In a multi-center trial, including multiple VA medical centers, 86% of the patients used Podometrics at a clinically meaningful level across the entire duration of the study on average. More excitingly, in a publication earlier this year describing current usage within the VA, 78% of veterans are still fully engaged with Podometrics 1 full year after enrollment, a tremendous improvement over any other solution that has been studied previously, at least as far as we're aware. But more importantly, the impact of the veteran and the healthcare system has been dramatic. One recent study came out earlier this month found 0 major amputations among a very high-risk population in the Mid-Atlantic region who used Podometrics. Equally important, the study also demonstrated a 40% drop in all-cause ER visits, a 52% reduction in all-cause hospitalization, and a 27% reduction in all-cause outpatient visits. For approximately every 6 patients just initially enrolled in the 1-year program, we eliminated approximately 1 amputation, more than 1 ER visit, and nearly 2 hospitalizations for every roughly 6 patients. That's astonishing. Just by providing a touch point for patients to engage with physicians when they need to, we're able to drastically improve their overall health while lessening the burden on the healthcare system. I'll leave you with this thought. No one should have to lose a limb to diabetes. And this is achievable. If we implement these sorts of technologies, we can help veterans maintain their independence and create value in the healthcare system. By simply focusing on prevention as opposed to treatment, we can have more cases like Walter's and fewer cases like Robert's and drive towards elimination of diabetic amputations. I want to come back to that number we talked about at the beginning, 0. Right? That's the opportunity and the achievable goal. Partner with us, whether you're a clinician, an administrator, or even the son or daughter of someone you love who is affected by diabetes. Let's assure that no veteran ever has to lose a limb due to diabetes. We have the opportunity to lead the entire nation here. If you have any questions, please reach out to the VHE Innovation Ecosystem or to Podometrics to learn more. Thank you very much.